So routine dental cares are those are very important. When patients miss a 6-month appointment or they prolong it to up to a year or 2 years, it becomes a repetitive habit, and they just keep pushing it off for an even longer time. So that's why we like to maintain the 6-month protocol or the 4-month protocol or whatever the patient may need, because it creates that routine and it creates that habit that they fall into. It creates a healthy, environment for the patient, because that way we can monitor whatever is happening in their mouth. We can't know anything if they don't come in. And coming in every 6 months is considered preventative care. So preventative care is the number one thing in dentistry. So if you're not implementing preventative care in your practice and, urging your patients to come every 4 to 6 months for their preventative appointments, there's things that can go undiagnosed, or there's things that we can't see or the patient won't know about until they feel a certain type of pain or something. And then it gets to a point where it's too late to do something about it, and we have to jump to like a worst case scenario. So preventative care in dentistry is everything. And that's why I always, like to reassure my patients and make sure that they're coming back every 4 to 6 months. Because if they're not, then, we got to make it a habit too, come in every so often. So, but like I said, the more you prolong it, the more it becomes a habit, and you're just going to prolong it even longer and longer. And then things go neglected and undiagnosed. And that's how we end up with, bad scenarios in dentistry where we have to do a bunch of stuff that we don't want to do. So yeah, preventative care is everything. And I think prevention is key, and making sure that you come in, see your dentist every 6 months at North Oaks Dental Westland. And taking our routine x-rays, doing our cleaning with our hygienist, having myself go in and making sure that, nothing goes undiagnosed, and making sure everything is in good condition. And consistent dental care checkups are key in investing in your smile. So when you invest in your smile, and you invest in a smile transformation or a veneer transformation or an implant transformation, whatever the case may be, if you're not coming in every so often for us to be able to check and make sure that our work is doing fine and that you're doing what you're supposed to be doing at home, how are we supposed to know? Otherwise it's just going to be a guessing game of, oh, are the implants doing fine? Are the veneers doing fine? So routine checkups are the most important thing when you are investing in your smile. So a lot of people think like when they get implants or when they get veneers that it's just like a one and done type of thing. It's not. You have to come in every 6 months and every 4 months or whatever your recall may be, and you have to check on the teeth and make sure they're doing fine and make sure everything's in good condition. Because if there's things that we catch early on, we can prevent these types of situations from happening. We can prevent damage from happening. So if we catch things early on, the earlier the better. So we always have to make sure that everything is in, good condition, and then make sure that you're getting your money's worth when you're investing in your smile, because otherwise there's no other way for us to know. North Oaks Dental Westland has a range in the hours that we open. So we have a couple of late days where we're open until 6 or 7 p.m. And I think that really helps accommodate people who work, or any working parents or kids after school. And we do our best to try to accommodate our patients after a certain time, if they need to, go during a lunch break, or if they need to come after work. And we try to make it a priority to get our patients in as soon as possible and according to the time that they want.